Okay, so this is the video that I promised my class in NURS 309 about the Mental Health Act, and it's just a quick rundown. It's the Mental Health Act in Alberta, first of all, so it doesn't cover any of the other provinces. They have their own acts. You have to take a look at them. You can get them from the Queen's Printer, which is like a place from the legislature that you can get, or from the courthouse downtown. If you're in Edmonton, if you're in other cities, you should be able to get them at the provincial courthouse as well. So I do have some notes here, so that's why I'm going to be looking down a couple times. But basically, the Mental Health Act is an Alberta-specific document that's designed to protect the patient and the public. So it provides authority, criteria, procedures, and timelines for apprehension, detention, admission, and treatment of a patient or an individual. So basically the first thing that we're going to go through is apprehension, which is like the authority. So there are authority forms. You can get 3 different kind of basic forms. Physician form is the form 1. We'll talk about that a little bit later. If you get a form from a provincial court judge, it's called a form 8. And if you have a form from a peace officer, it's called a form 10. So we'll go through those forms in a little bit. But basically what happens based on admission is you have a form 1. That's normally what happens if the patient is getting admitted because of a psychiatrist, but you can also have like the form 8 and the form 10, like I said. So the person gets admitted. Form 1s last 72 hours if the patient's in the community, so they have 72 hours to get the person into the facility, and then that first form 1 will last for 24 hours. So a form 1 means that a physician has certified that 1, a patient's suffering from a mental disorder, 2, that they're likely to harm themselves or others or suffer substantial deterioration or mental impairment, and 3, they're unsuitable for admission in other ways than formal. So basically that means they're not going to voluntarily admit themselves. So like I said, that first form 1 is for 24 hours. Before that 24 hours comes up, so within 24 hours before the first certificate expires, you need to get a second form 1, which is a completely different physician signing a new form 1, and that second form 1 is going to hold the patient for a whole month. So at that point, the patient has access to what's called the mental health patient advocate. The patient's officially certified in the formal way, and basically in order to access the review system, they have a right to fill out what's called a Form 12. So a Form 12, the patient needs to complete themselves. You can't complete that for the patient, but they have the right to have access to that. They can phone the mental health patient advocate. There's like a call hotline that you can call, and they'll be able to help them out with the Form 12 and kind of let them know what they need to do. Once they submit that Form 12, it has to be reviewed in 21 days. So if you're thinking about it, your patient is in their first certification, they still have their second Form 1, keeping them at the hospital, and it's going to take up to 21 days for them to review. So that might be something that if the patient has the capacity to understand that, you would let them know, it's going to be almost to the end of your first certification. Does it seem like they're going to be recertifying you? And obviously, if someone doesn't know that, that's okay. But if they're worried that they're going to get their Form 1 turned into a Form 2, which is the next thing that we're going to talk about, then it can be worth it for them to have the review done. And obviously, it's their right, so if they want to have it done, even if they're only going to be there for a month, they want to get out those extra 7 days early, that's completely their call. So before the second Form 1 expires, so again, you can't let the forms expire, you have to go all the way back to the first Form 1. The second form is what's called a renewal form. So what happens is a psychiatrist, so it has to be a psychiatrist for at least one of the 2 doctors that are going to fill out the Form 2. So a psychiatrist and another doctor or 2 psychiatrists sign a document that's basically saying the same thing as the Form 1. The person needs to continue to have treatment. They're not going to be able to be in the community without it being a significant danger to themselves or to others. And once that Form 2 gets signed, then the first Form 2 is going to have an extension of 1 month. The second Form 2 is going to be another extension of 1 month. And then the third and any subsequent Form 2s have 6 months to add on. So one Form 2, 1 month, one Form 2, another month, so that'd be in there for, if you're counting the first Form 1, 1 month, first Form 2, 1 month, second Form 2, 3 months, and then third Form 2, they'd be for an additional 6 months, so they'd be in there for 9 months. And then anything after that will just continue to add 6 months. So that's kind of the basics of what the forms are. As far as things like patient rights, which are really important, you can review them in the Alberta Health Services Mental Health Act document. But basically, patients have the right to send and receive communications from outside the facility without the communications being opened, examined, or withheld. So it's not the same as being in a correctional facility. They are allowed to meet with visitors at approved times unless the physician considers a visitor that would be detrimental to a patient's health. They are allowed to visit from a lawyer. They can contact the mental health patient advocate for information, advice, or to lodge a complaint. And that's only for involuntary patients. So if someone is in an institution and they've voluntarily submitted themselves, they don't have access to the patient health advocate in the same way. So back to what patients have rights to, they have the right for treatments, but they also have the right to refuse treatments. They have the right to control, and they have the right to ask for a second opinion. So if they don't agree with the forms, that's going to be where part of the review comes in. And so just a little bit of differences between the certification and the self-admitted. So when someone's voluntary, they're self-admitted, and they can be discharged any time, even if it's against like physician orders or against physician advice or against medical advice. Sometimes it's called an AMA. Involuntarily, it means that they're brought in by authorities and they have 2 Form 1s. So once that's done, there are still some other forms that you need to know about. So the most important ones, number 1 is a Form 5. So that's what they're going to fill out if the patient's going to be transferred to a facility outside of Alberta. Again, the Form 8 is that judge's warrant. So a little bit more about the Form 8. Basically, they're certifying that the same thing as the physician is true, but they can't actually certify like a diagnosis. So they just think that there's going to be a risk to the community or to the patient themselves. And that Form 8 lasts 7 days. So they have 7 days to kind of apprehend the person. Whereas if you remember before, the Form 1, they need to have 72 hours within that 72-hour period to bring the patient into the hospital. So a Form 10, basically a public police officer, so like a peace officer or an EPS or CMP, will state that they saw X person doing something that they thought was either like harmful to themselves or harmful to others, and then that'll give you the same authority to bring the person into the hospital. Another important form is Form 11. So Form 11 means that the physician thinks that you're incompetent to make treatment decisions. So what that means is that they don't think that the person is able to decide for themselves. So they can't just go straight into treating the patient without any kind of consent. They have to have what's called a Form 12 and then a Form 15 for treatment without consent. And the only thing that really is not allowed or not covered under this is psychiatric surgery. So that would mean like something that's going to be invasive, and that does still need the patient consent or the patient's guardian if they're considered not fit, because it's an invasive surgery. So we want to make sure that we're getting people's rights held up here. And that is the door.